Hi, it's River. If you haven't seen any of my other videos, my channel is dedicated towards myself and my system, and you'll understand what I mean by system in a moment, but it's the process of us learning about having dissociative identity disorder, figuring out about one another, and then also um, getting clinically diagnosed. We were recently clinically diagnosed with dissociative identity disorder. So I wanted to make a video just kind of updating the video that Zendaya did, where she spoke about how our doctor had diagnosed us with trauma and stress-related disorder with dissociative features. And I kind of wanted to unpack and describe my experience with telling my doctor he's wrong and him coming back to me and saying, "You're right, I will correct it." So after he told us that he thought we had trauma and stress related disorder with dissociative features, we brought it up again about, I don't remember. My memory is so bad because I have amnesia, which is like a big pillar point of this disorder, dissociative identity disorder. A big part of it is amnesia. So it's gonna be really hard for me to retell the story because the details are so hazy for myself. But so months ago is when he first brought it up, that he thought we had trauma and stress related disorder with dissociative features. I don't remember why he brought it up. I think we asked him what he thought about the diagnosis, if we thought we had it or not, like if we thought we had DID. And that's when he first had told us that, well, DID is not in the DSM, which he told us today that we were right, he was wrong. And anyways. And at the time, we knew we were right and that DID was in the DSM. However, we really lack assertive skills, especially myself. And usually I'm the one who talks to my doctor. So not wanting to like question his authority and also not wanting to upset him or like embarrass him, I guess. I just kind of went along with it and I continued to go along with it, to the point that I even started to question myself and I wondered, well, maybe I'm the one who's wrong. And I think you'll see that in our videos that we posted about how, maybe we're the crazy ones, but not to use the crazy word. But yeah, we spoke with our doctor again today. Not today, it was on Friday, I believe. And it was after Zendaya made that video. I believe it was myself. Yeah, it was me. And I said, you know, I like if you ever seen, not ever seen, but if you ever heard about DBT, dialectical behavioral therapy, one of the interpersonal effectiveness skills is a concept called Dear Man, and that's currently the module we're doing right now. We've taken it twice before, but we're doing it again. And the training, or not the training, the session that we were working on right now was Dear Man. And as an exercise, we're supposed to do these things we're being taught in the real world. So I was like, you know what, I'm gonna Dear Man my psychiatrist, and I horribly did Dear Man. The deer was fine, but the man was absolutely horrible. And I don't want to get segued, but just look up Dear Man, and basically the stay mindful, appear confident, and negotiate. We were horrible at. I was horrible at. But like the describe, express, assert, reinforce. Logically, we did fine at, but we did not appear confident, and we did not stay focused, stay mindful. So, anyways, so we asked him to like please just humor us at the very least, look in the DSM and tell us like what you see, if we're right, if we're wrong, whatever. And our psychiatrist at the time was like, you know what, why don't I bring in the DSM? And the reason I wanted to make this video because I wanted to express the importance of what a good rapport, patient doctor rapport can do for someone's healthcare. So the only reason I was able to tell my doctor and Dear Man him was because I felt safe enough with my doctor that one, he would genuinely hear me out and respect what I had to say, and also that when I made the request for him to actually look in the DSM, I had faith and trust that he would actually do that and then tell me the honest truth when he came back to me. And at the time, because even though I was very hesitant to say this, I knew I was right and that DID was in the DSM. So my doctor had gone and he came back today when I saw him because I'm still inpatient at the doctor. I'm just on a pass because I was supposed to be discharged today, but that's going to be tomorrow. Anyways, my doctor had come back and we actually forgot about this, to be honest, because Having diagnosed is really important, but like we have more important things to talk about. Not like I'd rather focus on the actual trauma. I'm getting distracted, but I'd rather do the actual work than talk with my doctor about what the label I'm going to be slapped with is. But we forgot about double checking with him if he looked and stuff, and we kind of got to a point in our conversation where like I wasn't really saying much more and stuff, and he was like, I had something I want to say, and I was like, what? And he was like, I looked, and you're right, DID is in the DSM. And what I'm trying to say, because I completely got distracted, is that the relationship that I have with my doctor is what led me to have the confidence to tell him he was wrong. And then the what should I call the how the fact sorry I want to make it clear that like I know my doctor, his specialty is adult psychiatry, so you're almost thinking like, how does he not even know it's in the DSM? Like, is he stupid? Is he uneducated? Is he not competent? None of those things are true. My doctor is very competent. One of the pillars of psychiatry and mental health is patient, therapist, facilitator, doctor, social worker, whatever, clinician relationship. So the key factor that makes my doctor a good factor is his ability to build rapport, to have me disclose things to him, feel safe enough with him. And that's what makes my doctor a good doctor, not his knowledge. Like, the doctors are not, I think the word is omnipotent. Like, they don't know everything, right? Like, they're going to make mistakes. That's a natural part of healthcare. It's what they do after those mistakes that shows if they're a good doctor or not. So my doctor definitely proved himself to me and just further built our rapport between us. And I think it's important. I just wanted to share my experience with that because somebody that commented on our last video and was like, yeah, like, DID is totally in the DSM. And we I don't know, we are uncomfortable with the fact that because I think Zendaya, it was Brielle actually, one of the female authors brought it up to him next time we saw him, and they were like, it makes us uncomfortable to not have DID in the not have it us be recognized with dissociative identity disorder in our chart, because even safety and being comfortable enough to tell nurses or other team members that we work with that we're not River, what they understand as me, which is really just all of us, because I'm not the only one, right? And I'm not the main one, I'm not the important one. We don't follow that philosophy. So they were like, it doesn't really make us feel safe because it's so stigmatized right now that people are just thinking we're attention seeking or that we're so and so. They wouldn't feel safe enough if it's not correctly diagnosed. Also, having correct diagnosis is just important overall in healthcare. So that's why we pushed with our doctor, even if none of those things were true and we just want to do it for ourselves. That's valid enough. So I think what I'm trying to say, what the point of this video is, one, if you have a good doctor or a good therapist or whatever, if you feel like you have this safety with them, this rapport with them to tell them when they're wrong about something, and if you don't feel like you do, it's either, I don't know what to tell, I don't want to give you advice, but to explore different options, figure out how you can build that rapport with them. And also that professionals make mistakes. That's a natural part of healthcare. And don't just assume that either their word is the law and that what they say is absolutely right, and or that you cannot do your own research or tell them that, actually this is my lived experience, this is what I'm dealing with, this is what I think it is. And I don't really know what I'm trying to say, but it's just important to recognize that mistakes like this are going to happen, not just for myself, but for other people. And I don't want anyone to question the validity of my doctor. I think this is a really good learning experience for himself, a good learning experience for me, and for those watching to recognize that this is a possibility for anyone and everyone. And yeah, I think that's all I'm trying to say. I'm getting lost in my thought right now. So the video is already 9 minutes, so I'm probably gonna end it here, and it's getting dark out. So I hope you like this video. I don't know if I said it, but yes, he came back and he said, "You are diagnosed with dissociative identity disorder." So so I know Zendaya made that video about how we officially recognize as a dissociative system, but now we are recognized as a DID system. So I will say, I think when I started this channel, I said I don't know if I'm gonna stop when I get official diagnosis, or I'll keep making videos. I'm gonna keep making videos. My system is enjoying doing these videos. We're learning so much about one another, and also there's still so much to learn and document and share our reality with people. So again, not an educational channel. We are not an educational channel, but we're just sharing, just talking about our life, just spilling the tea, as they say, as the youngsters say. So yeah, that's it. So I hope you like this video. Should I get a cake and cause all the controversy that Percy Locks did? I'm not being dramatic, so sorry. Take care.